I am Dr. Paul Salins. I am the medical director of the Mazumdar Shaw Medical Center and also the managing director of the Mazumdar Shaw Medical Foundation. I am a craniofacial surgeon, and this is one of the major services that I provide in this institution. I already gave an introduction to craniofacial surgery, but now I will speak about sleep apnea. Now, we know that sleep apnea and snoring are two disorders that nowadays it has come to very much prominence because people are speaking about the multiple consequences that problems with sleep can cause. This is really true. Very often we think that snoring is without consequence, and we think that the so-called sleep apnea is a more serious condition where there is not only noise that is produced when you are sleeping, but also what happens is that at certain times your breathing almost stops and the oxygen level is significantly reduced in the blood. And this leads to very serious consequence. Indeed, many times the way your hypertension, even your diabetes, and number of other disorders, particularly cardiac disorders, are potentiated or increased or becomes difficult to control is simply because underlying all this is a problem of sleep disorder. As we grow older, one of the big problems about brain degeneration, degenerative brain disorders or memory loss and so on and so forth that we speak about could very well be that underlying all this is a problem of sleep. Because sleep is the time during which your brain processes information. Now, when I go on the streets, I notice that a lot of people are walking about with very small chins. Very often we think that this has no consequence. Actually, you will find that a small chin very often is the first sign or the most obvious sign of a tendency for sleep associated disorders. If you find your husband or your son or daughter actually opening the mouth and sleeping, what we call mouth breathing, then again you do know that one of the biggest causes for this is that you probably are having a sleep associated disorder. If your mouth begins to smell in the morning and you find that you have what we call halitosis, the probability is that you have been mouth breathing, the dryness of the mouth and the breathing disorders it is causing is producing the secondary problem. Even if you have a cardiac disease or a diabetes or hypertension which is not easily coming under control, my recommendation is that you go to a craniofacial surgeon and to a pulmonologist or anywhere where there is a robust, a comprehensive sleep medicine facility and have it investigated. The management of this takes according to the cause. Sometimes snoring and other things can be caused by very simple non-surgical interventions where we create a tightening of your soft palate and so on and so forth, and the different soft tissue structures which are necessary. Sometimes the definitive management of this requires a small surgery where the mandible may have to be repositioned to accommodate it. Sometimes it is because a simple dietary advice asking you to lose weight very often has a very good effect in improving some of the conditions. And sometimes you also require pulmonological management and different sort of BiPAPs and CPAPs and so on and so forth, which are technological devices which help it. And sometimes if the associated other disorders are there, this has to be managed comprehensively by a pulmonologist who is interested in sleep medicine and a craniofacial surgeon who is interested in the aspects of correcting the deformities, and also a dentist who is able to provide dental solutions to some of the problems. I think this is a very important aspect of disease which we very often neglect to our peril, and this is something that should be always attended to and easily corrected. Thank you.